Namaskar. A very warm good morning, good afternoon to all the doctors who have joined us on this live telecast of the webinar on the platform of indianvedyas.com. My name is Anuj, and from the entire family of Dabur India Limited, I would like to welcome all the doctors, Vedyas who have joined us for an interesting session with a renowned doctor, Dr. Kohli. And before going into the topic and telling more about the webinar, let me give a brief introduction about Dr. Kohli. Dr. Vijay Mohan Kohli is a senior consultant cardiac surgeon at the Fortis Memorial Research Institute, Gurgaon, and Pashupati Singhania Research Institute, New Delhi. Dr. Kohli is a specialist in adult cardiac surgery with expertise of over 8,000 cardiac operations with India and overseas at the University Hospital Uppsala in Sweden. He was instrumental in setting up cardiac surgery departments and initiating cardiac surgery in various top-notch hospitals within India, such as Escorts Heart Institute, New Delhi, Batra Hospital, New Delhi, Hero DMC Heart Institute, which is in Ludhiana, Sri Balaji Action Medical Institute, New Delhi, and Arjuna Heart Institute, Nagpur. Dr. Kohli actively practices and promotes holistic medicines and is passionate about integrating Ayurveda, naturopathy, and other complementary systems into the mainstream of medicine. And today's topic that Dr. Kohli and we have chosen is something which I think almost everybody is grappling today, especially the younger generation and people who are very living a very hectic lifestyle. Acidity or hypoacidity. So there are both sides of it. Hyper is when the acidity becomes high, and there's hypoacidity. So both of these are a problem. And as to how these are problem and what are the remedies that we can look out, including a lifestyle modification and diet and other things, I'll request Dr. Kohli to please start the webinar and help us understand better about such an interesting and a challenging topic. Over to you, Dr. Kohli. Thank you so much.
Thank you. Thank you very much, Anuj ji and Devesh ji. It is again a great pleasure to be here with you. And this time the topic is appears very simple, but unfortunately, I think all over the world, it is not being managed the way it ought to be managed. The reason I've given a slash between hyperacidity and hypoacidity will become very clear as we go along. May I have the next slide, please? Now, as I said, hyperacidity is actually a misnomer because, next one, please. Most of the times, whenever a person has problems of heartburn, then they're all labeled as hyperacidity, and heartburn can occur because of many other reasons as well. We'll discuss all that as we go along. Next one, please. Now, hyperacidity literally means increased acid in the stomach, and we, of course, in medical terms, call it as hyperchlorhydria. Next one, please. Now, hyperchlorhydria has been given other names also, like sour stomach, acid stomach. And for obvious reasons, it refers to a condition where the level of the hydrochloric acid in the stomach is beyond a reference range of 1:3. So whenever the pH is around less than 3 or around less than 2, we call it hyperchlorhydria. Now, the point I want to make out here is there are two main things I want everybody to focus on. Now, even if the acid in the stomach is higher than it should be, it does not cause any negative consequences unless it is associated with condition like acid reflux or gastroesophageal reflux disease. And whenever acid production is high, it is because of the production of gastrin, which is the hormone which is responsible for that. And remember, hyperacidity or hyperchlorhydria as such is very, very uncommon. We take it to be common, but the fact is otherwise. Next one, please. Now, what causes high stomach acid? The most important reason is because of drugs. We are inducing hyperacidity in most people because rebound acid hypersecretion occurs due to drugs like ACE2 blockers and PPIs. A vicious circle ensues. When you give a PPI or you give ACE2 blockers or you give antacids, then the acid decreases in the stomach. When that happens, there's a rebound effect and more acid is produced, more symptoms happen. So, more and more of these drugs are given, and this cycle goes on and on and on. Now, stomach acid can also rise because of tumors like gastrinomas, H. pylori infection, gastric outlet obstruction, or chronic kidney failure. But all of these four causes are very unusual. So, the take home message here, as far as cause of hyperacidity is concerned, is that we are actually causing it, and we should understand why and what to do about it. Next one, please. Now, conditions which are normally attributed to hyperacidity are many. Heartburn is one of them. So, whenever a person has heartburn, he has acid reflux, he has GERD, indigestion, bloating, burping, gas in the abdomen, loose motions, all of these are clubbed together in as hyperacidity. Now, what is heartburn? We know all that. Mild to severe pain in the chest, which increases mostly after taking a meal or while bending. And in this, what happens is that the lining of the esophagus, as you know, the esophagus is basically alkaline in nature. So, whenever there's a reflux and acid from the stomach goes into the esophagus, then it irritates the lining of the esophagus, leading to symptoms of heartburn. So, this is not, in pure terms, hyperacidity. Next one, please. Now, heartburn also occurs because of wearing away of the stomach lining. The stomach mucosa is used to a high level of acid in the stomach, but if it wears off, then what is left behind is not used to whatever level of acid is present in the stomach. And this wearing off occurs because of many reasons: stress, alcohol, H. pylori infection, aspirin, ibuprofen, other medications, coffee, etc. So remember, heartburn is not directly a symptom of increased acid, though acid is acting upon the mucosa and causing problems. Next one, please. Same thing applies to gastritis. Now, gastritis also we assume it to be because of increased acid production, but the fact is again different. Gastritis occurs because of inflammation in the stomach, which can occur because of stress, bacterial infections, parasitic infections, H. pylori infection, alcohol, coffee, and autoimmune diseases. And this may later on lead to ulcers and bleeding, etc. So, again, gastritis is not directly because of increased acid production. It is because of inflammation in the stomach, and because of that, whatever acid is present starts irritating it. Next one, please. Now, what is acid reflux? Now, we know all about that. Acid reflux, the sphincter at the lower end of the esophagus prevents the food from going back into it if, however, it becomes lax. So, we are aware of this sphincter. Now, this has a specific tone which is under autonomic control. Now, as long as the tone is okay, then this will prevent any food from the stomach going into the esophagus. But if the tone is lax for whatever reason, in that case, whatever acid is present, now this does not mean that the stomach secretion of acid is more, but there is always a certain element of acid in the stomach. So whatever there is along with the food which is present in the stomach goes into the esophagus and leading to acid reflux. This, in as far as Ayurveda is concerned, is an upward moving Vata problem. Next one, please. Now, what causes acid reflux? The very important causes, stress and anxiety are very important causes of acid reflux. Foods like chocolates, tomato based foods, spicy or citrus fruits, alcohol, coffee, being overweight is another important reason, cigarette smoking, magnesium and zinc deficiency, food sensitivities like gluten, H. pylori infection, and many drugs again, calcium channel blockers, nitrates, anti anxiety drugs, antidepressants, and all that. All of these are known to cause acid reflux. Next one, please. Now, an important cause of acid reflux is what is generally not even thought of, and that is hypothyroidism or Hashimoto's disease. This is because the thyroid has receptors in the stomach and the GI tract. So, whenever there's the inadequate thyroid hormones in circulation, because of that, one can develop symptoms of acid reflux. Next one, please. Next one. Now, what are the symptoms? We are all aware of that: heartburn, cough, sore throat, bitter taste in the mouth, pressure in the chest, tooth enamel wearing off, asthma, difficulty in swallowing, etc. Now, all of these are general symptoms of acid reflux. Next one, please. Now, this is something which is important to understand. Now, what happens is we have already discussed this part. This part prevents any food from regurgitating into the esophagus, and this is the pyloric sphincter. No, yeah, that is fine. Now, no, no, next, yeah, uh, no, you've gone too far ahead. I'm sorry. Please come back to that original slide. You have to come back more. Okay, just stay there. We have discussed this. Can I have the next one, please? Next one. Next. Okay, please stay here. Now, the most important causes of this type of a problem are stress and anxiety, and they have a very strong relationship. Now, whenever there is anxiety, anxiety reduces the pressure at this point, because of which stomach contents go into the esophagus. Along with whatever acid is present in the stomach, it goes in there, irritates the esophageal mucosa, causing heartburn. And stress and anxiety may also cause long lasting muscle tension, which affects the muscles around the sphincter. And because of that, they are instrumental in pushing the acid up into the esophagus. So, high levels of anxiety can also increase acid production. Next one, please. Now, hiatus hernia is a condition which occurs later on as a complication of gastroesophageal reflux disease. Now, again, what happens is that when the esophageal sphincter, the lower esophageal sphincter relax, then a part of the stomach may go in. At the same time, what happens is that the other parts of the stomach may adhere to the lower end of the diaphragm. So, hiatus hernia is another problem which occurs as a complication of gastroesophageal reflux disease. The presentation may be fairly similar. Usually, the small ones are asymptomatic. Next one, please. Now, what is the sequence of events? This is very interesting. What happens is that when there is less acid in the stomach, then the stomach, as a protective mechanism, closes down. Closes down in the sense that this part, this sphincter, does not open. So, food and whatever acid is there stagnates in the stomach. And also, if there's a laxity of the lower esophageal sphincter, then this acid goes up. So, this is the sequence of events. Low acid, food stays in the stomach because the stomach shuts down. It shuts down for a very simple reason, that everything which happens inside the body is protective for us. It shuts down because the type of pH present here is not conducive. If acid goes in here, it can lead to problems. So the stomach closes down. The acid has no other option but to go back into the esophagus and causing these problems. Now, so it becomes very clear that hypoacidity, less acid, is what causes symptoms of hyperacidity. This is sort of a paradox. So hyperacidity, hypoacidity, acid reflux, GERD, hiatus hernia may have all very similar symptoms. That is why they are confused. If you feel uncomfortable immediately after eating spicy or acidic food, it is most likely due to too little acid. If, however, heartburn occurs 30 to 60 minutes after a meal at night, then it is likely to be due to insufficient bile flow from the liver or gallbladder. This is because it takes some time for the stomach acid to build up and or spill over into the small intestine. So low bile flow is equal to low acid production. So if you have symptoms immediately, okay. Now where is ACL produced? Next one, please. Now ACL, as you know, is produced from the parietal cells which are present in the stomach. Next one, please. Now, what are the signs and symptoms of low acid? Now, these are important. Any sense of fullness, bloating, belching, burning, flatulence immediately after meals should alert you of the presence of hypoacidity. Indigestion, diarrhea, constipation, upper digestive gasiness, iron deficiency, weak or peeling, cracked fingernails, itching around the rectum, multiple food allergies or undigested food in the stools, chronic candidiasis, and dilated blood vessels on the cheeks and nose in non-alcoholic. This is very commonly seen in the Western population. So if you have any of these symptoms, you should immediately suspect that the person has low stomach acid and act accordingly. Next one, please. Now, how can you test? There's a home test for confirming whether you have low acid or you have high acid. Now, whenever you have symptoms of so-called hyperacidity, what you can do is mix a quarter teaspoonful of baking soda in a cup of water and drink it before a meal. If you feel better, then the symptoms are due to too much acid because baking soda is alkaline and it helps. Now, the other thing you can do is mix 1 tablespoonful of lime juice and 1 tablespoonful of apple cider vinegar and drink it before a meal. If you feel better, it means that you have too little acid. These are very simple tests which you can do at home. And then you can get an idea of what is happening and corrective measures can be taken. Next one, please. Now, testing for ACL levels, there are of course methods which are available like acid pH metry can be done, or you can also test for parietal cell antibodies, which most people don't do, but that will give you a very good idea whether the stomach acid is adequate or it is not adequate. Next one, please. Now, there's a trial which I'm explaining here of giving betaine hydrochloride. So if you suspect hyper or hypoacidity, you're not sure which of the two is happening, what you can do is take 350 milligram of a protein containing meal. No, sorry, take 350 milligram of betaine hydrochloride after a protein containing meal. The normal response in a healthy person would to develop heartburn. Now, if there's no heartburn felt, it indicates that it means that you don't have excess of HCl and that the stomach may not be producing enough hydrochloric acid. So you gradually keep progressively increasing the dosage, first starting with 2 capsules with a protein containing meal, then increase it to 3 capsules. You can go even further. Now, whenever symptoms of tingling, heartburn, diarrhea, or uneasiness occur, cut back by 1 capsule. So this will correct the level of hydrochloric acid in the stomach. This trial is pretty simple. Betaine hydrochloride is available also. So one could try it if it is required. Next one, please. Now there's certain self-tests for problems with indigestion. Now there are three parts to a healthy digestion. We need pancreatic enzymes, we need bile acids, and we need additional stomach acid. Next one, please. Now we know that pancreatic enzymes are of three types: lipase, amylase, and protease. So whenever a patient complains of indigestion or fullness 2 to 4 hours after a meal, or stomach distension or bloating or flatulence 2 to 4 after a meal, 2 to 4 hours after a meal, if there's undigested food and stools which are pale, foul smelling or bulky stools, chronic constipation, glucose intolerance, swelling over the ankles. Now, if your answer is yes, and the score is between 0 to 3 points, that means that the enzymes are probably all right. If the score is more than 4, then you have to add pancreatic enzymes to correct the problem. Next one, please. Now, how do you know that stomach acid is adequate or not? The symptoms we had already discussed before, but I'll just tell you the scoring part of it. If the answer is yes, from 0 to 4 of these questions, that means your stomach acid is okay. But if the score is more than 5, that indicates that there is less acid, and acid has got to be replaced by giving betaine hydrochloride. Next one, please. How do you check for bile acids? You suspect if there's a history of if cholecystectomy, if there are low levels of vitamin A, E, or K, history of chronic diarrhea. And again, if the score is from 0 to 1, then bile flow probably all right. If more than 2, then bile acid supplements have got to be given. Next one, please. Now, role of PPI. This is very important because proton pump inhibitors are the ones which are being used right, left, and center across the globe. And they, as I've already mentioned, cause more harm than good. So they should be avoided for long term use. You may give them for short term, but not for long term. Next one, please. Now, what are the effects of PPIs? They have a lot of side effects and complications. One is the obvious one. They reduce the stomach acid, which is not good for you. They stop the ability of mitochondria to produce energy. They may lead to chronic kidney disease. They may lead to production of entirely new types of gut bacteria, which may be harmful to you. There's increased incidence of pneumonias in these patients. Then they also foster incomplete protein digestion. Next one, please. Next one. Antacids and PPIs are also known to produce osteoporosis. This is due to poor absorption of calcium and magnesium. And PPIs also decrease bone density. So there's so many points against the use of PPIs. We should remember that. So I'll repeat, whenever you have to, if you at all you have to give them for the short term, but do not give them more than 2 weeks. I see patients getting this for years together with resultant complications. Next one, please. So something more about hydrochloric acid. We know that hydrochloric acid is actually, next one please, is very similar to Agni. It is because of Agni basically. The only difference is that when we talk of Agni, which has been classified into many types in Ayurveda, we know that. But the Agni, when we talk about in Ayurveda, is responsible for Agni all over the body. And it has functions for practically every system in the body, including eyesight and so many other things. HCl, hydrochloric acid, is Agni related only to the stomach part. Therefore, not as important or as potent as Agni as such, as described in Ayurveda. Next one, please. So, digestion determines overall health of an individual, which is based on Agni. If fire is strong, one is able to take in various foods, they can be properly absorbed. We know that whatever we think, whatever we see, whatever we hear, and whatever we eat or drink, every single thing needs to be properly digested, absorbed, assimilated, and the waste thrown out. So Agni does this. HL, of course, is localized. Next one, please. We'll skip this. Next one. Next one, please. Now, when there's low acid in the stomach, there are lots of diseases which can occur. So, whenever a person suffers from asthma, one should think of low acid, celiac disease, chronic autoimmune diseases, diabetes, Addison's disease, eczema, psoriasis, gallbladder disease, Sjogren's syndrome, hepatitis, lupus, myasthenia gravis, osteoporosis, pernicious anemia, rheumatoid arthritis, thyrotoxicosis, Graves' disease, hypothyroidism. So there's a huge list of problems which can occur because of low acid. Next one, please. So remember, again, I'm just repeating, hyperacidity, reflux, gastritis, GERD, leaky gut, allergies, skin problems, all basically denote that one has low acid in the stomach. Next one, please. So how do you manage? The idea is, of course, this is based on principles of Ayurveda. You've got to bring the patient to a level of, the correct level of Agni in the body. And since the process of digestion is based on multiple factors, therefore all need to be addressed, which means the mind, body, spiritual approach is definitely a must for management of these conditions. Next one, please. So, firstly, the type of foods. You have to stop and restrict many types of food. For example, hot and spicy food, fried, processed, preserved, or packed foods, tomato based foods, alcohol, caffeine, smoking, sugars, gluten. Do not eat just before going to sleep. It's best to have an early dinner, give a gap of about 3 hours before you actually go to sleep. It is not a good idea to eat when the stomach is already full. Eat only when you are hungry. Maintain an optimal weight. Stay relaxed. So these are the basic things which we need to do for these patients. Next one, please. Digestion, as we know, is is an intuitive process, and we all know that the process starts when the food is being cooked, when you've not even tasted it. The very smell of food being cooked stimulates the mind, the brain, and also the production of salivary fluid. And then we know all about the fact that the person cooking should, be very loving like a mother, because we believe that those good vibration, loving vibration get transferred to the food when you eat it. Never eat food in a hurry. Chew the food very well. Try to avoid drinking any water in between. If you have to eat any foods, do them later. So these are very general things which everybody knows, and these are always taught in Ayurveda. Next one, please. No, please go back. Now, intermittent fasting is a wonderful method and very effective method for managing all of these conditions. And as I've already mentioned before, no, please go back. No, please go back. Back. You have to go back further. Okay, next one, please. No. Okay. Yeah, please stay here. Now, many patients, as I mentioned earlier, have been on antacids or H2 blockers for a very long time. And we get tempted to stop them. Once you hear about all this, you may want to stop the antacids or PPIs immediately. You should never do that. They should be gradually tapered. Like if a person has been taking, let's say, Pantocid twice a day, 40 milligram twice a day. Now, I would tell him to alternate it, like take first, start taking on alternate days, and then after 3 4 days, start taking only one on alternate days, then one every 3 days, or something like that, or SOS. You can also add apple cider vinegar. No, please go back. I'm not through. Next one, please. No, you have to go back. Yeah, please stay here. Now, as I said, please stay here. I don't know, there's something wrong somewhere. Please go back. Okay. Please go back. Okay, please stay here. I mentioned that you can give apple cider vinegar, celery juice, coriander may also be added. Aloe vera juice is very effective. Sucralfate is something which we give pretty often. And if symptoms occur at night, then you can give melatonin 1 to 3 milligram, which you can consider because it increases the tone of the lower esophageal sphincter. Then there's, I told you about betaine hydrochloride. This comes in the form of Enzar H or super enzyme. I've already discussed that. Next one, please. I've already discussed this. Now, okay, as far as prevention is concerned, you have to be natural in all respects. Now, natural means that your eating habits should be natural, your thought processes should be natural. We have discussed this before. Food should be natural as far as possible, should be fresh and seasonal. The habits of eating should be natural, 2 meals a day. Avoid snacking. Take your dinner 3 hours before sleeping at night. Resort to intermittent fasting. Regular exercise, yoga, pranayam. Try to stay relaxed. Meditate. Next one, please. Now, yoga, of course, is very important. Of these, the most important is Surya Namaskar, because this not only does it affect all the seven chakras in the body, that means it improves the physiology very well, and at the same time, it also stimulates the vagus nerve. And when the vagus nerve is stimulated, it has an extremely good effect both on the stomach as well as the mind. Next one, please. Talasana is another one. Next one. Padhastasana. Next one. I'm only mentioning the names of the asanas. Yoga Mudra. Next one. Marjari Asana. There's no time to discuss these in detail. Adho Mukha Svanasana is specifically good because this also stimulates the vagus nerve. Next one, please. Vagal stimulation is, I've been mentioning this almost in every slide, in other presentations also. And stimulating the vagus nerve is important because the vagus, as you know, starts from the lower end of the brain. It supplies all the parts right from the brain to the rectum. It has branches all over, specifically branches to the stomach, the intestines, liver, pancreas, all of these. So when the vagus nerve is stimulated, or if it has a normal tone, then it is extremely good for digestion. And this can be done by doing face massage, qigong, tapping, splashing cold water on your face, om chanting, specific asanas like face yoga, Surya Namaskar, Talasana, Yoga Mudra, and a specific kriya called Kapol Vikasa Kriya. Next one, please. This can be done, I already mentioned all these. Next one. So vagal stimulation is part of face yoga. As you can see, you have Kapol Vikasa. As I mentioned, this vagal stimulation, you make different, shapes of your lips, your mouth, and you keep churning air inside the mouth and all that. Anything which you can do to the face is going to stimulate the vagus nerve. Next one, please. Kapol Vikasa Kriya is a very specific Kriya which stimulates the vagus nerve. This is a very important maneuver taught in yoga. Next one, please. We'll skip this. Next one, please. Next one. Now, pranayams, you know that they are all important. They also affect the vagus nerve. Then they have other benefits also. Next one. Now, this is a very specific pranayam called Pratilom pranayam, which has been devised specifically for the diaphragm and the low esophageal sphincter. Now, what happens in this is that you breathe in against resistance. Because of that, the diaphragm constricts. And as you know, the esophagus enters the stomach through a hole in the diaphragm. So when the diaphragm constricts, it improves the tone of the low esophageal sphincter. When that happens, in due course of time, the regurgitation subsides. Next one, please. So this is the method. You sit comfortably in the full or partial lotus position. Place the thumb and middle finger on your nostrils. Take 10 deep inhalations through partially closed nostrils. By closing the nostrils partially, you are producing resistance so that you can create enough resistance to feel the diaphragm contract as you inhale. Now, please go back. Now, you can actually feel the diaphragm contracting and follow each inhalation with a full exhalation without any nostril resistance. You may also perform kumbhak after that. Initially, you can start with 5 rounds only, gradually build them up till you get used to it. And as I said, this sort of this Pratilom pranayama is extremely effective for improving the tone of the low esophageal sphincter. Next one, please. Yog Nidra is the best method for relaxation. And as you know, if you're mentally relaxed, then every single cell of your body functions optimally. Optimal and best quality chemicals, hormones, enzymes are produced. So your relaxation is extremely important. And you know very well that stress plays a very important role for secretion of hormones in the body, secretion of enzymes, everything. Next one, please. Then meditating on the Manipur chakra, because the Manipur chakra is the one which regulates digestion. Manipur chakra has an effect on your stomach, pancreas, liver, intestines. It has an effect on your eyesight. It has an effect on many other parts of the body because, as you know, that there are 10 types of prans which are present. Five are mukhya prans and five are uprans. All of these are regulated by the Manipur chakra. So when you meditate on this chakra, the mantra for this is Ram. The method we can perhaps discuss later. Next one, please. So to conclude, one, hyperacidity is very uncommon. Most symptoms are due to too less acid. Avoid the long-term use of antacids, PPIs, etc. Prevent it by leading a natural life, and mind, body, spirit need to be in balance. Eat natural food, have natural thoughts of love, kindness, compassion, empathy. Live in a natural environment, stay connected with nature, remain grounded. There's something known as forest bathing, tree hugging, grounding. Stay in nature's circadian rhythm because every organ has its own clock, so also the stomach. Then, of course, yoga, pranayama, and meditation. Next one. Thank you very much. Stay relaxed because if you are relaxed, then the stomach acid secretion would be optimal and you would be more or less free of disease. Thank you very much.
Thank you, Dr. Kohli, for such a nice presentation and simplifying things and putting things in perspective. Well, we will open the session for a question and answer, and at the last part, I will wind up with some of our products. So, all the doctors, Vaidyas who are watching this webinar on YouTube, Insta, Facebook, and other platforms, please you can post your questions to Dr. Kohli, and Dr. Kohli will answer this. Dr. Kohli, one thing that you mentioned very interesting was, and the fad is catching up very fast, is about fasting. The intermittent
Yes,
fasting.
yes,
So, but many of the times, Dr. Kohli, what I have come across and read is that it also hampers or has kind of a bad effects if it is not done properly, right? So
yes,
the
yes,
younger generation, right, in the quest to lose weight and to kind of get in shape, right, they do a lot of fasting, right? So can you please elaborate on this and help us better understand if somebody has to do a fasting, intermittent fasting, right? What should be the time gap, horizon, right? And how we can plan this out in a much much better way, sir.
yes. See, basically, the thing is that we first need to understand that a body needs only 2 meals a day, ideally speaking. Now, those patients who have had a cholecystectomy done, in those patients, we do not resort to 2 meals only. We make it three because we don't want them to fast for too long. And when we talk of intermittent fasting, we're basically talking of 16 hours fasting and 8 hours off. This is the usual thing because this has been researched the most. But there are things like 24-hour fasting, 36 hours fasting. There are lots of types. There can be pure water fasting also. Now, I'm basically talking about 16-8 because this is the simplest to do and has excellent results. So first, I would like to first ascertain whether the patient has any cholecystectomy done or not. If not, then I'll go ahead with the 16-hour fasting. But because the body not used to it, so first I start with 12 hours for say about 10 days to 2 weeks. That means have an early dinner, say around 7 o'clock. Go to sleep after 3 hours of the meal so that there's proper digestion taking place. Now, when you get up in the morning, now between 7 p.m. and 11 a.m., now there can be a little variation in this 7:30, 11:30, 8 p.m., 12 noon. But try to stick to 7 p.m. for the dinner. In between, you are recommended to have lots of water unless water is contraindicated for some reason. For you having kidney disease, maybe having cardiac conditions. Other than that, water intake should be quite adequate. Also, because during this type of fasting, very often dehydration occurs, and also very often sodium depletion starts taking place. Therefore, you need to supplement a little bit of sodium in your diet, and the sodium should be not common salt, but pink Himalayan salt or something like that, so that your sodium levels are okay and your fluid levels are okay. Because otherwise, now intermittent fasting is a detoxifying process. So whenever you start any detoxification, you know very well, Ayurveda, of course, has described it, that you start getting, a healing crisis, which means certain symptoms start developing. You may develop weakness, you may feel tired, you may feel lethargic, you may get a headache, you may get a body ache, you may even get a little bit of fever. So, just to prevent all that, you should remain properly hydrated and also have adequate sodium in the food. You can also have green tea in this fasting period. You can have any vegetable juice also in this fasting period. You can have apple cider vinegar in the fasting period. You can have black tea or coffee in this fasting period. So, when you have your meal at say 11 o'clock, at that stage, you start first with taking apple cider vinegar to break the fast and then have your meal. So the meal should be at 11 o'clock. In the meals, there are three or four important things to remember. One, wheat should be stopped completely. If you are pre diabetic, then that will suffice. But if you are a confirmed diabetic, then along with wheat, all grains have to be stopped. Sugar has to be stopped in any case in all situations. Sugar, I mean white sugar. If you're not a diabetic or pre-diabetic, then natural sugar could be taken like from fruits or from khajur and figs and things like that. You stop milk altogether and you stop rice. You stop all refined food, all packaged food, all preserved food. Any of these unnatural things are to be stopped. And when you have your meal, your focus should be predominantly on vegetables, those two, as far as possible, green vegetables. You need to restrict uh, potatoes and arbi and all that. Other than that, vegetable intake has to increase. And vegetables can be taken as either smoothies, they can be taken as salads, they can be steamed, or they can be taken as cooked. So depending on your temperament, like if you are Vata predominant, obviously you're going to restrict the raw vegetables. But if otherwise, steamed can be taken by anybody. So focus on steamed vegetables. You should, as far as possible, have chach or raita made out of hung curd. Have some homemade pickle, and then when you have your lunch say about 11 o'clock, then at about 4 o'clock you can have a vegetable smoothie or something like that, or some nuts, and then your dinner at 7 o'clock again. This is the usual pattern. But in case you are still eating refined foods, you're still eating wheat, you're still having milk and all that, then you'll feel very, very hungry. It may be very difficult to do this intermittent fasting because wheat, as you know, gets digested very fast. So when you take millets in place of wheat, they take a longer time to be digested. So you can have millets if you're not a confirmed diabetic. In the case of a confirmed diabetic, you need to have either coconut flour or almond flour or flaxseed flour. That's it. Once the diabetes settles down, then you can go back to millets and all that. So this is broadly speaking what we do. We also reduce the fruit sugar. So very sugary fruits we avoid, like bananas, grapes, chiku, and things like that. The fruits which are recommended are things like plums, kiwi, papaya, guavas, things like that you can have. So there's a long and short of it. But depending on the specific problem, we modify it accordingly. In case of autoimmune diseases, this has to be modified even further. I think that should suffice for the moment.
Thank you so much, Doctor. So one of the doctors is asking regarding the recent, government regulation banning the ranitidine and others, right, which is uh, leading to antacid. So some of the doctors want your inputs on that as to should we continue using that or should we stop that? So your take on that, sir?
See, as I said that from the beginning, as far as I'm concerned, none of these conventional antacids, PPIs, any of these are recommended because the action does not justify anything. As I said, when you take these antacids, they reduce the stomach acid. And the cause most often is low acid as it is. So if you're giving any of these, you're reducing the acid further. When that happens, the body starts producing some more acid, you get symptoms, you give some more antacid. So they are not recommended at all. The reason I said was for 2 weeks was a very simple reason that the patient may get after you that I'm having so much of burning, I'm having so much of problem, do something. Because whatever I have discussed so far will take time for it to act. So antacid will act immediately. So maybe in the first 2 3 days you may give it, but ranitidine as it is stopped. But Pantocid and Pandy thing like that are still in vogue. There are some other ones also, but basically they all act in the same manner. So they are not recommended because in that case, what I recommend people are Ayurvedic preparation that they should have those because they are acting at a different level. They are taking a lot of things into account. They are holistic. So they are going to be more helpful to you rather than taking an antacid straight away. Change your lifestyle. But in an acute event, well, perhaps you have to give Pantocid for a short while.
Great. So, sir, as you rightly said, regarding the formulations which are available in the market and which are antacids, be it PPIs or be it anything, right? They do not treat the root cause or does not provide a holistic solution. And more
Yes.
so often, sir, correct me if I'm wrong, that you mentioned a term called as rebound effect, right? Which very well happens if a person who's a chronic acidity patient, right, or a chronic hypoacidity patient, if he takes on antacid for a longer period of time, the rebound effect sets in, and the dosage of the antacid goes up, right, and which
Goes up.
leads to kind of a vicious cycle, right, sir? Right.
Absolutely.
So in that context, I just wanted to highlight one of our key brand in the management of antacid, which is very aptly coined as active antacid. So it is antacid, a herbal preparation, and it is active. So it is an active antacid which provides relief at a faster pace. Devish, next slide. So, sir, the composition of this is pure Ayurveda one. No allopathic or synthetic supplements we have used or ingredients we have used, sir. We have Bringraj, Giloy, Yeshti Madhu, we have Trivit also. And these are in a very, very rationalized and very efficacious form, which provides instant relief, sir. Apart from this, sir, Nishot and Yeshtimadu, which has been documented in Ayurveda to regulate the acid secretion, because that is very, very important. Giloy has also been documented for anti-spasmodic and anti-inflammatory properties. Bringraj is which kind of protects the liver and kind of supports the liver health. So this is a very unique composition that we have, sir, and the dosage can be, depending on the condition of the patient, right? Normally, it's two teaspoon, right? Half an hour or 1 hour before, after the meals, right? Or whenever the patient feels. So typically, after the meals, if the patient takes, it kind of provides a very, very effective efficacious, what do you call, effect in managing the hyperacidity. And the actions are being an Ayurveda solution, being an Ayurvedic preparation, sir. The action starts in less than a minute, and which we have documented in our studies at the DRDC Dabur Research Center, right? So there we have conducted a study, and we found that the action of active antacids starts in less than a minute, sir. So the relief to a patient comes in a much faster way and without any side effects, sir, because it's being an Ayurvedic preparation, a pure Ayurvedic preparation. So apart from that, sir, the key benefit of active antacid is that it provides quick relief from acidity, prevents reoccurrence, which, as you rightly mentioned, sir, kind of the rebound effect. So it does not lead to that. It is the only preparation, I think, in the Ayurveda space which not only provides relief from acidity but also helps in the entire digestion, right? So the entire digestive process, right? So right from the food ingestion to the expulsion, the entire digestive process. So it helps in that, sir, and this has been clinically tested. And the best part is that it is 100% Ayurvedic with no side effects. Personally, sir, as a professional, I also get some bouts of acidity sometimes. So I've taken this, and it has provided fantastic kind of relief. So I think this can be one what do you call product that should be there in everybody's home, being an Ayurveda product, and instant relief in 1 minute, which I think is like the hallmark of this product. So maybe, sir, you can use this in some of your patients at some time and see the results, sir. So this is a very unique product that we have, sir.
Yeah, I have been using this, advising it to patients.
Yeah,
But my thought process is that whatever medication we use, we
sure,
still must resort to a holistic management. Lifestyle
absolutely,
management is a must for anything because you can't keep giving these things indefinitely. They're okay
absolutely.
for the time being, but ultimately you got to find the correct solution and act according to that.
Correct, correct. So there are a couple of other questions that the doctors is asking regarding the probiotics, right? So does probiotics taking on a regular, what you call daily routine, including them, do they also kind of help in patients which are chronic? I do understand for patients who sometimes get the problem of acidity, it might help, but for a patient who has been chronic, as patient for say like 2 years or 3 years, so does probiotics play a key role there, sir?
Hmm. Well, I must explain this. I'll take a little while to do that.
Sure,
One is
sir.
that there are two things. One are prebiotics and the other are probiotics, right? Now, prebiotics and probiotics are both present in food also. In fact, the bulk of prebiotics are present in foods only. Things like, green vegetables, things like onions, garlic, ginger, these are all prebiotics. So these should be, in any case, part and parcel of our diet. Now, probiotics are also present in a lot of foods, especially fermented foods. Our Indian cooking, our Indian kitchen has charch is a very important thing, but the charch will be made out of hung curd. We have raita, we have chutneys, we have homemade achar. All of these act as probiotics, and all of these they're all fermented. So anything fermented, apple cider vinegar is another one. Apart from that, there are some more which are now coming into India. For example, sauerkraut, kimchi. Kimchi you often get when you go to these Chinese restaurants and all that. These two type of things. Then a third very important thing, and that is known as kefir. It is written as Kefir, written as kefir, but it is pronounced as kefir. Now, kefir comes from many sources. So any of these can be used, and these are excellent probiotics. So these are as far as the food is concerned. If there's an acute problem and you have to give supplements, then you have to give resort to good types of probiotics. Now, probiotics contain live cultures of bacteria. So the important ones are the lactobacillus group and the bifidobacterium group. These are the two most important ones. There are many varieties of these. The usual probiotics sold in the market do not have an adequate amount or quantity of these. So you got to check whether the probiotic has lactobacillus species like L. reuteri, things like the L. reuteri. There are many more, Lactobacillus rhamnosus, and I mentioned about the other one. So if these are present in them, then only are they going to be effective. And that too, if the quantity is enough. Now, what I personally have been using as probiotic has been mainly two. One, which is easily available, is known as Econorm. Econorm is a fairly good probiotic, and whenever I use it, I advise it for at least 2 to 3 weeks and start it the moment you start giving antibiotics. So give it for about 2 3 weeks continuously, and later you may follow it up by VSL3 is another good one. But VSL3, the problem is that it needs to be refrigerated. So you're never very sure whether the chemist has kept it at the right temperature or not. You may not know it. You may not get the correct instructions. You may leave it in the open, and then it's not going to be effective. So the probiotics like Visilac and things like that are totally ineffective. They're not going to help you. Now the question arises: when are these to be used? One, if there's any history of antibiotics, you've got to take probiotics. Or if you suspect gut problems, you have to take probiotics. Now, as far as the gut is concerned, managing the gut is a huge, huge problem. And there are different stages of doing that. So normally, if a person has gut issue like a leaky gut and thing like that, then for the first 2 weeks we detoxify. That is, we remove all the dead bacteria, all the bad guys from the stomach, and for this we need to resort to certain antibiotics, certain other things, certain other natural products. After that, only do you supplement things, and then the role of anti and the probiotics comes in. So initially, you can start one type of probiotic, and later a different type of probiotic. So this is a huge chapter in itself. I think we might have to discuss the gut some other time in fair detail to be able to understand what to do, how and when.
Great, sir. So I think, sir, this was very well explained because many of the people, and especially youngsters, think that probiotics can, certainly help to reduce acidity problem and things like that. But prebiotic equally are very, very important. And certainly a holistic approach for condition like acidity is hyperacidity or hypoacidity, a holistic approach in terms of dietary modification, lifestyle modifications, exercise, meditation, yoga. So I think these entire activities will certainly help in the management of a challenging condition like acidity, although it looks very easy on the surface. But somebody who suffers from chronic acidity, the patient knows, how painful it is, and how the patient is devoid of a quality of life. He cannot enjoy a good meal, right? He cannot enjoy certain things in life. So I think that's a very interesting topic that, sir, you have chosen today, and you have thrown light on that. And I'm very sure that the Ayurveda doctors who have listened to us, the channel partners who have listened to us today, will certainly will be enlightened and much more in-depth understanding about such a challenging subject. And also people who want to lead a healthy life, right? Minus the acidity problem, certainly can incorporate some of the suggestions that you have made, sir. So much thankful for your time and suggestions, sir. It's a pleasure always to listen to you, right, sir? And I will also like to thank IndianVedas.com, especially Dr. Piyush, for having this session on the platform. And from the entire family of Dabur India, we thank all the doctors, Vedyas who have listened to us. And we'll see you next month. Till the time, from all of us in Dabur, a happy weekend. Enjoy your day. Thank you so much and stay healthy,
If
stay safe.
you
Thank you so much.
if you think proper, then maybe we can take up gut health next time, because in
Sure,
as a continuation, because it is a vast topic
sure, sir. We can.
and
We
it
can.
cannot be summed up in just a couple of minutes.
Sure, sir. We will. We
Yes,
will, sir.
all right, we can take that up next time.
Do, sir. We'll do, sir. Thank you,
Okay.
sir. Thank you so much, sir. Thanks. Thank
Thank
you
you
so
very
much.
much.
Bye, sir.